Okay, so I'm going to introduce you to our speakers. We're very, very pleased to be joined by Crystal Dennis, who's the lead for digital access to home services, and Ben Norman, who is the head of engagement and communications at Dorset CCG. They're both going to be sharing the innovative work going forward in Dorset and what impact this has had on patients and GP practices now and in the future. Crystal's worked for the CCG for the last 4 years, and during this time she has helped drive the digital transformation within healthcare, more recently leading on a programme to empower patients to take control of their own care. Ben has over 20 years experience in communications, engagement and journalism, and is a passionate supporter of communicating with patients using digital and non-digital platforms. We'll also have Steve Aylwin, who is Head of Workforce Transformation and Digital Workforce at our Dorset Integrated Care System. He's worked within the NHS since 2014, and he'll be talking about the Embedded Digital Champions project today. He's passionate at supporting NHS staff and residents in Dorset to make the most of the new digital applications in healthcare. And last but very much not least, we'll have our own Jim Gammans, who many of you already know from his work with PPGs. He'll be talking today about how PPGs can help GP practices communicate better with patients. So sorry, that's a bit of a whistle-stop, a potted history of all of our speakers today. So without further ado, I will hand over to Crystal. Over to you.
Thanks ever so much, Jill. I appreciate that. Good morning, everybody. Thank you for having me. I think, Jim, you're going to share some slides. Is that all right from your end? Super stuff. Thank you very much. Nice to see a few friendly faces, some that I've met before as well. What I wanted to do is please do use the chat, because I'm sure that there's going to be quite a few questions and we want to get through as many of them today as possible. But also, if we can't or we run out of time for any reason, I think the presentation's just over half an hour, which gives us a decent amount of time for discussion. But if there is anything that we can't get through to today, then we will, of course, kind of send out some answers to questions as part of a follow-up. So like Jill said, I've worked for the CCG for a few years in digital. It has been a little bit of a baptism of fire, because my background is not in digital at all. It was previously in mental health services. I'm a dental nurse by background, and then I have worked with the ambulance service in their 999 and 111 service for a few years before I came into the digital kind of home. And whilst my role is hosted by the Clinical Commissioning Group, I actually work across all of the health organisations in the system, and I interface, or I have touch points with the local authority digital health agendas at Dorset Council and at Bournemouth, Christchurch and Poole. So the type of service that myself and my team provide is here up on the screen. We're all there around, in essence, apps and wearables. So it's any piece of software that somebody can use either with or without a medical device, like a pulse oximeter or a blood pressure monitor, a thermometer, something that can help somebody stay safe and well or monitor their condition at home. And that's really what we do. And we try to do that as safely as we possibly can, because there's lots of regulations that we have to adhere to. But it's really about being a consistent offer. And ultimately, the area that we most work in, just purely because of how health works, is in primary care, primary and community care. So we work a lot with district nurses, with the nursing teams, with pharmacists, and with the GPs in primary care and community care. And a lot of the benefits of that work is felt through into our acutes and our hospital teams. So the aim is to be consistent and to make sure that there's equity in that offer across the system, and that we are monitoring the impact, or looking at what the benefits are and what the value is of the work that we do, because it's still quite new. But whenever we are, and so part of it will go through today, the difference in the technologies and the offers that we've currently got in the system that you may or may not be aware of, but is also to look at kind of some of the barriers that we have to overcome, and how we're working with areas like our digital champions and with our comms teams, so that we've got more of a joined up offer. So with everything that we do in this world of med tech, is what we call it, there are 4 main barriers that we have to overcome when we're doing each of these projects. Number one is that everyone has to be aware of it. And it's not just for patients being aware, but it's also the workforce being aware. And if we can overcome that barrier, it's how do then they access these tools? How do they use them? And ultimately, if we are having something that has an algorithm or it has some type of machine learning in it, we have to help the teams learn to trust that as best as possible. And we have to help them escalate any risks that they may see that comes out of working with those technologies. So there's something around kind of the communication side of things, being aware what's available, how to access it, learning to trust that, and how to escalate where there is a mistrust, and then a team of people coordinating it. We don't use the term governance because at the moment it's really about working with where it's appropriate and not kind of mandating any of these things. So that's ultimately what our services do and the challenges that we have to overcome. Thank you, Jim. So up on the screen now, you will see that we have a multitude of different technologies that are available to our population currently. And not all digital health technologies are actually the same. So if you have a look on the left-hand side of your screen, where we've got our 8 boxes with COPD, heart failure, brain in hand, arthritis, these are long-term condition management tools. So they're there to support our pathways. So they're there to support the services and the clinical leads. And these technologies are quite heavily regulated because they have advice and guidance in them that are usually given by a clinical team. And the purpose of those technologies are really about accelerating or having a quicker access through to services. So it's all around kind of symptom tracking for patients to monitor their own conditions. There is online rehabilitation approaches. So particularly with my COPD, it has online pulmonary rehab. In my heart, there's online cardiac rehab. And these types of services are usually done by our acute teams, our respiratory and our cardiac teams in the hospitals. But particularly during COVID, when that was no longer really an option, these were the default tools that they used. And they wrapped around kind of their services with that, with maybe some group video consultations, group therapy or group discussions, but certainly kind of gave a quicker way of accessing those services in a safe manner. And so that's really the purpose of what they have. It's really about somebody having a tool that we all trust, but then also around patients monitoring their conditions, that if they then see something that's not quite right, so they see their scores are perhaps a little bit lower or they're feeling a little bit more worse, it's following up with their clinical teams or with their clinicians in their more traditional manner. So we do virtual kind of caseload management with this, not true full remote monitoring. But what happens is if a patient then decides to make contact with their team, the team can quickly go on and have a look at what the patient's been doing in those portals, have a look at those scores so that they're informed before they make that contact back with the patient. So that's really the value and the purpose of these technologies. So quickening access to services, giving the patient the tools in the hands that they need that is trusted by the clinicians, and then allowing the patients to be working with their symptom tracking from home unless there is some type of a deterioration or some type of a worsening score. What you have on the right-hand side, sorry, Jim, we go back to that other side. Thank you, it's me. If you, on the right-hand side of that screen, you will see something called digital health information. So this is really around kind of the well-being agenda, and it's around providing information to our population in a way that they would want to choose to receive it. And there's many different ways of doing that. So we have websites. And we've got quite a few big key websites that we have in Dorset. We have Wessex Cancer Matters, we have Maternity Matters, we've got Dorset MSK. There's also the big national website, NHS UK. But then we also have our app library and our video library for patients that want to either watch something or track their own condition. Maybe a tool that we haven't necessarily made available as part of our services, but patients have the choice of having a look through those themselves. And so it's really about surfacing that, and we work quite closely with our public health teams and also with our local authorities on those offers. Then on the top right-hand side of your screen, we've got 3 boxes here that talk about pulse oximetry, blood pressure, or BP at home, and ACR. And these are different types. They're very heavily regulated, these technologies, but they are more geared towards remote monitoring of a patient. So usually a patient that is at risk of a deterioration, or they're at risk of a hospitalisation, or it's a screening or it's a diagnostic tool. And the clinical teams watch these tools quite carefully. So pulse oximetry is for patients that are positive with COVID and have a high risk rate of deteriorating. And the reason why we brought this in was because of silent hypoxia. So if a patient has COVID and for instance, they are above a certain age range, or they may be a male, or they may be of a BAME ethnicity, particular markers that we know have a serious effect on a patient with COVID, we offer them the option of using a piece of software to stay at home, and then with a pulse oximeter to feed in their readings 3 times a day. And they can do that a few different ways. It's not just about an app. This particular technology also allows a patient to feed in their readings via a text message or through an automated telephone call, but also through a telephone call with the clinical teams directly. And that has been, that's really been quite a value during the pandemic. So what happened was each of the GP practices, they were able to refer patients in to that service, and that service was hosted by Shaw Medical. And then those readings came through from those patients 3 times a day. And if there was something that was of worry when the readings came through, then there was a trigger for a clinical member of the team to get in contact with that patient within an hour. So it just meant that we were able to manage a much higher amount of patients with a smaller clinical team that was dedicated to looking at that, and that's still ongoing at the moment. The blood pressure at home is very much a proofing concept at the moment. So we are working with 7 primary care networks. And again, that's a piece of software that is given to a patient that's classed as having high blood pressure or hypertension. And if somebody has hypertension or prolonged high blood pressure readings, that's a marker for a patient developing something more serious in the future, like a cardiovascular disease or having a cardiac event of some sort. And so what happens is we provide the patient with a piece of technology and a blood pressure monitor. But what's really important about this is not just about what the patient does, but in the back end of this technology, there's a lot of machine learning that works under NICE guidelines. And what it can do is make recommendations on different types of medications that the clinical team can prescribe to that patient in order to lower their blood pressure readings. And so what we can do is use a different part of our workforce to manage those dashboards or that remote monitoring of a patient and escalate to a pharmacist or a GP where those readings are a little bit high. The ACR technology, this is the more simpler out of those 3. ACR is called albumin creatinine ratio. And what this is for patients with either cardiovascular disease or patients with diabetes, there are certain things that NICE, our regulatory authority, NICE make guidelines and say you have to check every year with these patients. So on their annual review, they do need to have a urine test, and the urine test is picking up that particular ACR marking, and that's a screening for chronic kidney disease. Patients that chronic kidney disease comes in 5 stages. They are deteriorative. And so patients that go undiagnosed in stage 3 usually end up statistically with an ambulance conveyance and a hospital stay. And so it was really to help patients kind of keep up to date with their ACR checks, because it's very difficult. Sometimes they'll come in, they'll do everything else and then go, I'll bring back my urine sample, or for some reason that urine sample is missed. And so it was really to make sure that there was an adherence to that annual check on a regular basis, and for us to pick up and get the patients onto their correct medication so that we prolonged their independence for longer and kept them healthier for longer. We have done a pilot at Weymouth and Portland, and that pilot has been very successful. It picked up, we took a we took a population health approach. So we looked at those that were most at risk of their ACR checks being high. We isolated those patients using the data. We invited them in, and then out of the patients that were invited, 97% of them accepted to do the test. 93% went on to actually complete their test, and out of the 1,500 patients that were identified, 207 of them came back with a high ACR marking for follow-up and for medication where appropriate. So we're moving into a proof of concept with that. Now, what happens is that the patient actually gets the kit, the home urinary analysis, sent to them at home. They're helped to download a piece of software, and there is an education as the test is processing, and then they take a picture and they screen those, and those results are dropped straight back into the clinical system, into TPP or System 1 that the GPs and the nurses use. So that absolutely is proven successful at the moment, and we're just working with 6 other PCNs to develop that data a little bit further before we look at how we might commission that or make that part of our standard care. So very different types of technology, very different values, but they are also, we are monitoring the data back from this just to have a look at how many of our patients are accepting these offers versus how many of them aren't, and is there any trends that we can see that can help us in the next project and help us develop kind of these hybrid, we call them hybrid services. They're not there fully to replace any of the clinical teams, but they are there to help them. And the reason why we are bringing these technologies in is because, unfortunately, we have a shortage of workforce. Now, this is not a recruitment issue, and it is not a money issue. We have a shortage of people choosing these types of careers in health over a prolonged period of time. And retention of our workforce is a challenge. They are exhausted. They are usually very burnt out way before their retirement age. And so we have to have an increased amount of them coming through in terms of training. So whilst it's wonderful for us to be giving gold standard face-to-face appointments, sometimes it just isn't possible because the population is much higher than the capacity of our workforce to see all of them and to follow up with that gold standard of care. So these are the reasons why we are bringing in these technologies. For those where it is appropriate for them to be seen using them or to be monitored using the technology, but then there is also the ones that just don't have the skill sets to use these types of technology, and it's absolutely okay for them to continue to be seen under a more traditional model of care. So this is not about forcing anyone, it is about using leveraging the skill sets. So if we have members of our population that have a smartphone, that are digitally literate and do not mind, with some support, using technology, it's those ones that we are looking to work with. We are not looking to drag anyone or force anyone into using these types of technologies where they just don't have those skills. So those are the different types of technology. You'll notice that there are quite a few of them, and it again isn't appropriate for us really to be asking you if you have COPD and you're a diabetic and perhaps you have hypertension to be using 4 to 5 different technologies. That's just not helpful. And so what we're doing is that we are actually working with the NHS app team, and we are also working with our Dorset Care Record so that we can actually combine all of these things. So there's just one piece of technology that you use that will give you that front door into everything else. Now, these two that you see at the bottom of the screen under Dorset Care Record and the NHS app, these are called personal health records. They're like your digital passport for your health and care that you can carry around with you. But they are very transactional. They are really around, apologies, let me just turn my husband's mobile off. Sorry. They are really around transactional kind of activities. So showing you your clinical correspondence from your GPs, or perhaps even your appointments from your hospital. They are around being able to gain access to doing online triage, or they are around kind of sharing documents from a consultant, perhaps to a patient goal setting. So they are very much more around the administration side of things rather than symptom tracking, access to online rehabilitation. So they are very, very heavily regulated. And they have to use NHS login so that there is a secure way of you verifying who you are, because we're giving you access through to your medical record. So very different types of technology. There isn't anywhere in the UK that has brought all of these things into one at the moment. So we are continuing to work with the enterprise architects, or those that do all of the clever things behind the scenes, to try and give a good user experience and without confusing everybody. So that's the type of work that's going on. But just a note for all of you, if you were aware, great. If you weren't, please, we're asking for you to contact your practice or your primary care network and to link in. We have a website that shows all of these different technologies, a web page on the Our Dorset site, and we centrally keep that updated with the pilots that we're doing, the proof of concepts that we're doing, but also the technologies that are available. And we know that in general practice, they do an awful lot around kind of supported self-management, and we would like all of our GP practices to have a link into that page that we keep updated for everybody as a means of trying to kind of help that awareness piece, one of those first barriers that we need to overcome. So please do feel free to have a chat with your practice to see if they can link into the Our Dorset digital pages, but also to ask them if they are using any of these technologies, because we want to help and make sure that there is a consistent offer. And we know that we're working with all of the PCNs across all of the technologies individually, but there isn't any PCN that's using all of these collectively. So we just want to make sure that we are helping with that consistent offer. Thank you, Jim. You may have heard recently that we did ask the teams in the primary care networks to actually make available kind of a SMS campaign through to everyone over the age of 18 to ask them to your digital literacy skills. Are you happy and able to perform digital kind of tasks, or did you just not want to use digital for your care? And there was a very specific reason why we asked this. We've been working with Dr. Simone Yule. She is there for helping access with the, or working in partnership with our voluntary care sector, but she is also working with our elective care recovery group. And so part of the data that was shown when we were doing our elective care work was that a lot of the patients that will continue on the waiting list, and you can see some of them here, you can see there are quite a few of them in terms of the thousands, they're trying to bring those levels back to a pre-COVID state. And so what we wanted to do was try and segment some of those that were going to continue on the waiting list. We were going to offer them some digital support whilst they continued to wait. But most importantly, we wanted to try and ease the pressure to our general practices and see if we could perhaps maybe do some better partnership working with our voluntary and charitable sectors, or with our local authority partners, by highlighting those that were on the waiting list but did have good digital literacy, so that everyone had a part in kind of offering kind of digital that could help support in the meantime. And so that's the reason why that campaign went out. It was checked with the IG leads, and certainly it was in the gift of the primary care networks to send that out and to collect that data. And that has actually given us a really good insight. Jim, if I ask you just to go into that next slide for me. Thank you. Here is a screenshot through from our DICE tool. So this is about a week old now, I think, but we've got just over 28,000 responses. And of those, you can see that 839 said that they do not perform technology activities, which was quite interesting that they took part in the campaign. But what that means, and next to that, you can see that there's just over 3,000 patients of those 28,000 that said they have difficulty in performing technology activities. And what this enables us is to work much closer with our digital champions that are hosted by Penny Siddle and her team over in Dorset Council, so that we can perhaps maybe have a look at who those patients are and give them an offer of working with a digital champion to try and help their digital literacy or understand those reasons a little bit more. Because like I said at the beginning, we don't want to force anybody to use technology, but what we do want to do is help those that perhaps need a little bit of support and are willing to work this way. So it was really just about working closer with the other services in the system that can help ones that are perhaps not as confident as some of our others. And what was interesting here, you can see on the right hand of the screen that actually the majority of the responses came from the 60 to 69 bracket, but we had good responses from 40 all the way through to the age of 79 and into the 80s. And actually that's not different from some of the other data we've received in the digital projects, where we've also been collecting and having a look at those that have adopted the technologies that we've made available to them. Very, very similar. I was quite interested to see that a lot of our younger ones didn't actually respond, and that could be because they didn't feel the need to, with the presumption that a lot of them have access through to smartphone technology and do use it. So that's just some of the insights that we can present, and you can see here at the bottom of the screen in the middle, we've overlaid this by showing the responses from those in the system and the areas of deprivation. And so we know that we have some issues where we've got areas of deprivation and that having a problem with digital. And of course, we have a little bit more of an insight now as to where we might target kind of where digital champions could perhaps do a little bit more work if we have volunteers or we have ones with that capability or that training in the system to help their patients. So very interesting, but I certainly wanted to just give you a little bit of an oversight of how that data is being used in the back end part of the system, and that we weren't just collecting data for the sake of collecting data. Thank you, Jim. If we go into the next slide. Right, I will pass over to Ben, who will talk to you a little bit more about some of the marketing and communication ways that he's working.
Thank you, Crystal, and thanks everybody for your time today. Hopefully you can hear me okay. I've got dogs and cats in the background, but hopefully my dog won't bark too loudly. The cat obviously won't meow too loudly. So, as Crystal said, I think this is it's a great opportunity here to engage with people digitally, but also in a non-digital way as well. And I think that's really important. And I think we've had kind of long conversations about that in terms of it's the two sides of the same coin, really. And we just want to talk about that side of how the work we're doing is digital, but also non-digital in that way. Particularly, we are using tools like Twitter and Facebook and Instagram, and they can reach a large audience of people. Interesting, of all ages, actually. TikTok might be the best forum for younger people, but actually large numbers of people of all ages use Facebook, for example. But at the same time, we can't forget more traditional methods of communication. And we've been working with Help and Kindness, which is a local voluntary organisation. And they very kindly did an audit for us, working with Public Health Dorset and Dorset Council. Well, actually, they showed there's more that could be done at a very localised level around putting up posters in community centres, local shops, in cafes and things like that, on display boards. And actually, on the back of that, this winter's campaign, which we've been doing, which is Let's Talk Winter, we've done out-of-home advertising. So we've done big billboard posters, we've done backs of buses, we've done the digital methods as well. But we've also done posters, leaflets. An example of this is the Kings Park vaccination site down in Boscombe. We're actually handing out a top 10 postcard to people once they've had their vaccination. So I think, and more importantly, word of mouth is really important as well. So I think what people say about accessing services, be it GP services or the services that Crystal's talking about, is really important as well. So and for us, that's really important. I think in terms of connecting digitally with your GP practice, just building on what Crystal said, obviously there has been national coverage around access to general practice and primary care. And I just wanted to reiterate what Crystal said. Across the whole NHS, everybody is working tirelessly at the minute with the ongoing pandemic to provide services, and particularly general practice, as pulling out all the stops and working tirelessly across our patch and across the whole country. And when you actually look at the figures, it actually does show an increase in appointments. It does show where there has been a reduction in, say, some methods of communicating or working with people, but actually the trend in telephone or virtual consultations can actually sometimes be what people would prefer. You know, you don't have to find parking, for example. It saves time if you're a carer or if you're got a busy family life, for example. But as Crystal said, for some people though, face-to-face is really important. So it might be initial contact as a telephone call, but if you do need a face-to-face appointment, that will happen. And throughout, Dorset, face-to-face appointments have very much continued. And I think actually, when you look at the figures, over 3 million. So actually, it's amazing kind of effort. And when you add into that primary care's delivery of the vaccination program as well, so not only COVID vaccinations but flu as well, where I often think about this time last year, no one in the whole country had had a COVID vaccination. And then on 8th of December 2020, the first one was given in this country. And in Dorset alone, we've given over 1 million vaccinations of the COVID vaccine. Outstanding achievement, and primary care has been right at the heart of that. And finally, it's my colleague Jim, who's done some outstanding work working in Weymouth and Portland around surveying and asking people about their trends and how they would like to access services. And there's some figures here from Jim's work on that. I don't know, Jim, if you want to talk a little bit more about that and your reflections on that survey. I just wanted to bring you in on that.
Yeah, absolutely. And again, this was something that that has shown the benefit of PPGs in within general practice. That following the start of the coronavirus crisis, the PPGs in Weymouth and Portland decided to meet more regularly, and they met virtually as well. And as part of this process, they identified, because of the changes that happened in primary care, that they were very concerned about how people access their general practice. Certainly those who maybe are digitally disconnected or digitally disadvantaged. So what we did is we worked with the PPGs and the primary care network, and then the project did expand. So we involved various colleagues within our own healthcare and within social care, and within the voluntary and community sector, to create a survey so that we could find out and really dig down to people in Weymouth and Portland, how they now access their GP practice, how they communicate with them, how they get to them. Also, if there's what access they have to technology, so things like mobile phones as well as smartphones, tablets, laptops, things like that, and also access to the internet, whether they get it broadband at home, whether they access it through third-party sites such as maybe cafes, libraries, things like that, or whether they do it through their mobile phone connection. And also we're asking questions as well to see if there were any areas in which patients were maybe disadvantaged, where couldn't actually get onto the system. And it was a really, really good piece of work, and it really gave us a really good insight into some of the figures. And we've got some of the figures that are posted up there. So that one of the good things is that a vast majority of people up to the age of about 74 do access the internet and access it regularly. And it's one of the things that we did find that people over the age of 75 and those who identified with a disability, those were far less likely to actually access the internet. So that, again, we could use that and use that piece of information to help identify and help pass on to our primary care colleagues in terms of the way that we communicate with people and how we maybe communicate different services and things like that. One of the great things we found that again, people who access the internet, they use it quite regularly for normal day-to-day things like accessing social media, for going to doing internet shopping, internet banking, and connecting with friends and family. But we found from our survey there that less than half of the people that access the internet and used it regularly used it to manage their own healthcare. So we saw that as a fantastic opportunity to really start connecting with those who are digitally savvy, those who are connected to the internet, those who use it on a regular basis, to maybe see if we can help them connect to the digital services. As Crystal's mentioned, there are many different digital services that are around, and it's fantastic to see the kind of the plethora of kind of like things that are available for people, and it's great to see that. But it's also a kind of thing where we can maybe help encourage people who are digitally savvy to use to make better use of the internet. So and those sorts of resources, so that then that the people who are less digitally able are then able to contact their practice in the traditional way and have more space for them so they can contact them. But again, one of the things that so if anyone does want information to do with the survey or anything like that, please get in touch with me afterwards, and we can have a look through, or I can help share the information with you, because there's some really good statistics. There's only a very small amount that we've gone through today, but there are some very, very interesting points that we've got there, and we believe that although it's taken place in Weymouth and Portland, we do think it can translate to a lot of other areas across Dorset. And if we go on to the next slide, getting on there. So in terms of getting digitally connected with your GP, along with some of the apps that Crystal's mentioned this morning, there are lots of ways that you can connect digitally with your GP practice and access your health records. In Dorset, you can access your records, you can order repeat prescriptions, and with some of your practices, you can actually book and cancel GP appointments, either with the System Online service, which is through your GP practice, or with the NHS app, or with the AirMid app. For those of you that haven't heard of it, the AirMid app is basically the same as the System Online accounts, but it's an app you can actually download for your smartphone or your tablet. Now, you can download the NHS app or the AirMid apps for free wherever you normally get your apps. And to make sure that you do actually have access to these services, you'll need your practice to give you access to System Online. So if you haven't already done this, you can do it simply, but just by contacting your practice, and they'll give you a username and password for System Online. But if you need to get full access, so you can view your medical, view all your medical records, you will need to contact the practice and present them with ID for security purposes, so you can actually get full access to all of the services. And the importance of checking your details. Now, since the start of COVID-19, practices have seen the importance of communicating with patients regularly. Normally, it's by text message or email, which means it's important for everyone to make sure that your details are up to date and your permissions on the GP practice systems are actually set correctly. Many GP practices are really creating some really good informative digital newsletters at the moment, but unless they have your latest contact details and permissions to send the information to you, you may not receive it. So you can check the information quickly and easily by accessing your System One account. The only way you can actually amend the details is via the System Online account, which is the one via your GP practice website. Unfortunately, you can't actually update these details through the NHS app or the AirMid app. But when you're on there setting the information up, again, just make sure that all of your information is correct. They've got your mobile phone number that's the latest one, and all the digits are correct. Make sure that your email address, if you have an email address registered with them, again, is spelled correctly. But also make sure that your permissions are set for the practice to send SMSs to you, and also double check as well that your preferred method that the practice contacts you. So normally that's SMS or email is probably the most preferred one. But again, if you need any information with that, again, please contact Jill and myself afterwards. And again, we'll be more than happy to point in the right direction. And we would encourage all PPGs to tell fellow patients, friends and family how they can access the healthcare digitally. Jill and myself will be happy to support any messaging you're looking to do, especially if you're looking to promote this through your PPG or your practice newsletter. But also PPGs are vital to help getting messages to people who are not digitally connected. As Ben has mentioned, certainly with the winter campaign that's going on at the moment, again, there is a digital element which we're sharing online, but there's also a physical element. So there are leaflets and there are posters that we'll have available, and we are distributing. There's various different town and parish councils, through GP practices, through as many touch points that we have with people that will physically go in and see and go in and see and be able to pick them up. But again, it's fantastic for yourselves as PPGs that you can actually share these leaflets and posters within your communities. And also, don't forget, word of mouth is such a powerful way to spread messages. By coming to events like these, you'll have a very good insight into what's happening locally in healthcare. So please tell your friends, family and neighbours and loved ones about it. It really is important that as many people as possible get the information that's come through. But thank you for your time, and now I'll hand back to Crystal.
Thank you very much, Jim. If we can just go into the next slide. I have been trying to respond to as many of the comments in the chat, but thank you so much because they are really key kind of questions. So keep them coming in. We just wanted to, you might see this little symbol on the right-hand side of the screen, and it talks about being well-led, having in smart foundations, safe practice, supporting people, improving care, healthy populations and empowering people. These are the success pillars as set out in the NHS England and NHS Digital and X framework for what systems need to look at doing and how we enhance our plans. And the part that I fall into is around empowering citizens. I think it's the most exciting. But what we have to do is everything we need to do must and should be co-designed with members of our public, as we act as a chief customer to the system on behalf of you. And so what we have done is that we've recruited a digital public engagement group. I can see that some of the members are here today, so thank you for coming along. And what we will do is be meeting with that digital public engagement group, or DPEG, on a regular basis every other month. And some of them have already put down a specific interest in working with the services that we provide to help that co-production piece. Now, the chair of the DPEG has wider kind of representation as we move into a new system or a new integrated care system. So they are very much at the heart of the representation, kind of with a digital lens on, and working with Ian Gall as the public engagement group. So what we would really like is to how best to engage, how best to keep all of you up to date. It would be nice if there was a couple of members of this group, of the PPG group, who would be able to act as conduits or links between what's going on in the DPEG and this group for an update, and that way we can kind of keep this communication going. So it'd be nice to have a couple of named persons come forward, but we just wanted to let you know that there is currently, at the moment, we're just doing a draft around what do we need to engage with our population, specifically online, because as mentioned at the beginning, we're really looking at working with those that have digital literacy skills in the first instance, and then looking at how do we engage with those that perhaps are not digitally literate as part of phase 2. So we're just looking at an online questionnaire that will go out to the public at the beginning of next year. We're going to present those plans back to our DPEG group on the 15th of December when they meet. And then should should that group be happy with that and endorse that, that will go to the public engagement group for approval on the 21st of December before that goes live. So, and we're hoping to bring that type of insight back. We are looking at the evaluation being kind of broken down into the primary care networks so that you know what the feedback has been based on your own individual area. And again, we can bring all of that information back and do another presentation to you perhaps in March of next year when that's been completed. So it was just to let you know that all of that co-production piece and then a plan of how we will do digital engagement working with Ben, because we don't want to work separate to the plans that he has around engagement in general, working with Ben and his team. So that's what we're hoping to bring back. So I just wanted to give an oversight of that. Thank you, Jim. And I will hand over to, is Steve on the call? Is he? Steve's here. I will hand over to Steve, who's going to talk a little bit more around embedded digital champions.
Thanks, Crystal. Morning, and everyone, and thank you very much for having me along. So the probably introductions at the beginning, I'm afraid I missed the beginning. I had to dash out to pick up my daughter from school. She's not very well. So again, apologies if we have any noise in the background. That will be her trying to make herself feel better by playing with toys. So as you probably know then for the introductions, my role is very much focusing on the digital capabilities of our workforce and how we can support our workforce across the ICS, integrated care system, to engage with new ways of working and digital ways of working in terms of delivering our important services to our patients and residents of Dorset. Hand in hand with that goes the requirement though to also support all of our residents of Dorset and anybody who's accessing services in Dorset, because I think that's even more important than our workforce being able to use those services, is actually that our patients and our residents are actually able to access those services and those new ways of working. So one of the ways in which we're doing that is through the Embedded Digital Champions program, and Crystal's made reference to this earlier on in the presentation. It's not a new program per se. It's been running now for a few years. It started with our colleagues in Dorset Council, and we have worked very closely with them in a number of key areas. The Embedded Digital Champions work on a very simple principle. It's about increasing people's capability in order to be able to help others improve their digital literacy. And it's about enabling people in the local community to access digital services. It's about doing so by providing peer-to-peer support. The way we've been supporting further is developing a network of digital champions. So our champions all have membership to that network of digital champions. They continue their learning together. They can support one another. They share their successes, they share their challenges, and it's great to see the learning continue beyond the initial training stage. And also for our digital champions, you notice that everybody is building their own personal digital awareness and literacy as part of that journey as well. So it's not just about helping others, it's about helping themselves. And when we meet with our digital champions, they often talk very, very openly about their own experiences. And one of the big things we hear them talk about an awful lot is how it's really benefited their close family and friends, because they're able to provide them a lot more support than maybe they were able to before. And it's normally just hints and tips and some things that we might even consider in terms of increasing people's digital literacy. So they say this has worked really well. The embedded digital champions that we have in the system already, maybe within libraries, for example, we've had teams that work within the council that have supported on particular programs where we've asked them to. And the opportunity is there for us across health as part of our integrated care system to have around about 350 digital champions working within and with the NHS. The overall ambition is to have around about 2,000 embedded digital champions across the whole of Dorset, which is really exciting. We see this working potentially in a couple of ways. So this is about working with our staff. So we have a number of employed staff who are being trained up as digital champions, some of those within GP practices, so they can reach out to their population, especially working with the data that Crystal shared earlier on, and offering clinics, if you like, sessions where actually people can drop into the GP practice and speak to the digital champion and receive some support to increase their digital literacy in the GP practice, or maybe at another place of their choosing within the community. What we're doing then with the digital champions is we are providing training. It's 6 hours in total, which includes contributions from Dorset Cybersecurity Police, who are experts in Dorset Cybersecurity Police, experts in digital accessibility tools, and we also provide soft skills training as well, recognizing that it's not just about the technical skills, it's also about the way in which we communicate with people, how we support people, how we put people at ease. I think digital and technology can sometimes strike fear into people, and it's overcoming those barriers and reassuring people that actually it's overcoming their concerns. And we follow the 5 themes of the essential digital skills framework. So we focus on communication, so things like video tools, social media, messaging. We focus on problem solving, so learning to overcome problems and how to search for information to overcome problems. We look at transacting, so how to carry out transactions using digital, so shopping, services, government portals, etc. We look at handling information, so data is really important, and great examples of data that have huge importance have been shared in today's presentation. Fake news is something that sadly is on the increase. So how do we support people to recognise and deal with fake news, and also the storing of information, and how to do that, and again the sort of things to be aware of when storing information or giving your information to other people to store even. And finally, how to keep safe online, which is a really important one. So that training is provided over a series of sessions, say 6 hours in total. It's normally 1 session a week, which is a couple of hours a week commitment to the training. And I say we then continue the training through our network of digital champions by keeping them connected, having regular catch-ups, talking about successes, challenges, and so on and so forth. The sorts of qualities that we normally see within a digital champion, people who are motivated to help others is very high on the list. People who are willing to understand and understand the need as well to build rapport with people. So I spoke about before those soft skills. People who are keen to promote the benefits of having digital skills. So almost ambassadors, if you will, for the importance of digital skills in the age in which we live now, not just around health, but in general in terms of engaging with the world. People who are digital enthusiasts and motivators, so people who are keen to learn and keep up to date themselves, people who are good communicators and active listeners, and people who are trusted and I think most importantly patient as well, and able to work at move at pace, the different pace of differing people's needs. Really important to stress though that the qualities that aren't necessary are being an absolute digital wizard. Okay, we're not looking for people who know everything about digital, although if we do have people like that, that's obviously a really helpful thing. But actually, we've found some of our digital champions have come in with very low levels of digital literacy and awareness themselves, and it is they've actually progressed the most and gained the most from being a digital champion. And I think because they've come from a similar starting point to some of the population and people they're supporting, they're able to form that connection in terms of, I know where you've been, I know where you're coming from, let me tell you about my journey and how I've got to where I am today. And I say we don't expect people to know all things digital. What we tend to find when we've surveyed people and evaluated the pilot, what people get from it is that they have the confidence to help others. Of course, they have those improved digital skills, that they either get more job or volunteer fulfillment if they're working on a volunteer basis, and they get recognition from their colleagues for the support they provide. There's the opportunity to meet new people in an online community as well, working across Dorset. That customers and clients become more digitally savvy and independent, which is great because it means people are engaging with services online, which, as Crystal's alluded to earlier on, part of this really helps in terms of reducing workloads where digital technology can perform well and support with services. It then frees up clinical time to focus on other areas where actually face-to-face interaction or human-to-human interaction is far more impactful when supporting patients, and we're definitely seeing the impact there. And then a raised awareness of digital support available in Dorset as well, not just about our digital champions, but learning all about all the other digital support that's available and being able to signpost people and again make use of those resources themselves. So it's been a really successful pilot, and I think the great thing about the peer-to-peer support, coming back to that one, is I've met a lot of people in my time in this role who wanted support with their digital literacy. And I think for some, it's a really easy conversation to have and to sort of reach out and say, I need some help with my digital literacy. But I think for others, there can be barriers around that because maybe it's something they don't feel comfortable talking about, or maybe they who don't want to ask silly questions. I think we've all probably been there at some point in our life, worried about asking the silly questions. So therefore, actually having that peer-to-peer support and having somebody who's in a similar position or has been in a similar position, I think, can be really, really beneficial. And using some of the examples that Crystal gave earlier on, if you think about some of the technology that's being introduced around specific conditions. So as a really basic example, the My Diabetes app, you know, if we've if I was a patient with diabetes, I feel I might connect better with another patient who has diabetes to be able to talk about my condition and the management of my condition using technology and digital. That would probably be a more meaningful connection for me, rather than the one with the clinician, if that makes sense. So that's why, again, we're really, really keen on having the peer-to-peer support as well, and about embedding our digital champions out in the community with volunteers and with patient representation as well. So hopefully that helps give you an overview. I did see a quick question pop up about how do I become a digital champion. I think it's about engaging with your practice, but also about engaging with us, and we can help achieve that. And we'll be really pleased to see more people come on board as a digital champion through the patient engagement groups. And I say we are working very closely with the practices and PCNs as well to train staff, but also for them to reach out to their patient representatives and patient groups as well. I'm going to pause there, I think, and hand back over to Crystal and Jim.